Hi everyone, this is Ricki Spencer and welcome to another episode of Our Health Matters Quest by Community. Today we have two important guests. We have Adam Johnston and Carolyn Campbell-McLean. They are two wonderful colleagues who I was absolutely fortunate to sit with on a very important advisory committee on life support in the home, part of the Energy Charter. We will hear the journey about why it's important to consider strategies in your home, especially if you are living with disabilities, and what to do when the outages happen. We will first introduce to Adam Johnston, who will tell us a little bit about himself. Welcome, Adam, to our show.
Thank you very much, Ricki, for inviting me.
And Adam, tell us a little bit about yourself.
My story was that I came to the Energy Charter because I'd been sitting on a prior committee with the College of Physicians, and the matter of electricity and power supply had come up, and I had regaled them with the story of my very inconvenient 5 days without power, which had prompted them to say, "Meet the Energy Charter." And before I knew where I was sitting as chair of a life support reference group, of which you, Ricki, were a member. But I must admit, the thing I learned very quickly was that my inconvenience was very much a first world problem, and many of the members of the community committee could relate stories of far more adverse outcomes, including deaths of loved ones, which has prompted me to try and promote what we are about to talk about on this program as far and wide as I can. So, again, thank you very much for having both myself and Carolyn.
Carolyn, it's wonderful to have you today.
Thanks for having me, Ricki. It's an honour to be asked to come on the program today. My name's Carolyn. I'm a social worker by training, and I work in the disability space with other people with physical disabilities like muscular dystrophy. I lead peer groups and run social and information sessions for people. So my story is how I got involved in the life support panel with the Energy Charter. Is that sadly, in 2005, I woke up on a Sunday morning. Myself and my husband were in our own home, and we woke up to a very bad storm. It was a very bad electrical storm, and unfortunately, the power went out. And sadly, Danny's he was on a 24-hour ventilation, so breathing machines in the home to help him continue to breathe, and the backup battery, which was connected to the ventilator, didn't work, and sadly he went into cardiac arrest. And we had a lot of struggles to be able to let the emergency services, the ambulance, into the home, because we also had an electronic front door, and that, with the power being out, also wasn't working. So we were in a real bother that morning, and sadly Danny passed away 3 days later in Westmead Hospital. So yeah, it was a very big traumatic event, I guess, in my life, and really changed the way I look at people with disabilities' need for power for essential medical supplies in the home. So yeah, that's how I got involved, and I guess I was asked to be part of the panel. So yeah, it's been able to really great to be able to turn a really traumatic and tragic event in my life into something positive, where we're doing lots of education and awareness work in the community, and specifically in the disability community, to help people understand what it is that can happen and how they can go best about preparing for such power outages.
When you spoke, it really does remind me as to why this is so important. For some people watching, you might have the power go out and you think, oh, that's inconvenient. I can't turn things on. I can't use my computer. But for some people, it is a matter of life and death. And that's why it's so important that we have this important conversation today. So I want to ask you to follow on from that. Another in question, which is what are some of the biggest day to day challenges that you face in managing energy needs in relation to life support?
The biggest challenge for many people, I think, is number one, the cost of living. I will note that many people on our committee have raised the cost of living and how power prices just keep going up, and how many people don't have control over their own housing. Housing is not secure, we know this, but it becomes a particular point when you are reliant on power for your very existence. So, all of these elements are not just theoretical, they are very real every day. And from my own perspective, working with this committee and working with the Energy Charter has made me realize just how many of the things I use every day and some of the vital pieces of equipment that keep me comfortable and safe and in good health rely on electrical power. And literally, there is no manual backup. It is a matter of power 24 hours a day.
And what about yourself, Carolyn?
I think you're right, Adam. Really, there's so many pieces of equipment that we rely on. You know, it's not just, well, I gave the example of the ventilator or the BiPAP or CPAP machine, but also just being able to charge your power wheelchair. You know, if you can't charge your wheelchair, you can't get around. I have an electronic bed that helps me with the carers being able to raise that bed and up and down. I have a powered hoist. They all need charging. So one of my main essential pieces of equipment is my mobile phone. I think everyone says they're reliant on their mobile phone, but I think particularly for people who, you know, I'm very in touch with my support workers and my carers, you know, by texting or by ringing them. And so, you know, if you can't charge your phone, you're really in a world of strife because that's your one, you know, major important communication tool that you have to stay safe in the home. So, you know, if the power goes out, the first thing you're going to reach for potentially other than a torch is probably your mobile phone. So yeah, if you know, you must always remember to have things charged up. Even as I said before, the electronic front door. If you can't open your front door, then you must have backup plans and secret keys, and you know, have alternatives so that if the power goes out, and let's face it, with all the weather events that have been happening, the floods and fires and tsunamis, and you know, the environmental impact is having a huge impact on our weather, and you know, consequently affecting so many people, you know, in the cities, but in the countries and all around Australia. So yeah, I think we all are very reliant on power, and particularly for people who might have some oxygen tanks, or they might need enteral feeding. You know, all of these things are relying on you know, gadgets that need to be either charged or need electricity to run. So really important to do thinking about what happens when the power goes out.
Oh, thanks for that really detailed response, Carolyn. And that leads perfectly to our next section, which is about understanding risk and preparedness. You know, what to do before an outage, what to do during a power outage, and then after a power outage. Those three integral, interdependent factors. So, Adam, what goes through your mind when you hear about a planned or unplanned power outage?
To be honest, Ricki, what went through my mind in the past was utter panic because I knew that the lights would go out, a lot of things, including my electric bed, would stop working, and progressively then further things, including my chair, just as Carolyn said, would also stop working. I would hope that after the process we have been through with the Energy Charter, and just at this moment, I'd like to stop and pause to thank our industry collaborators who have supported both Energy Charter and the Life Support Reference Committee to fund our important work to facilitate gatherings with important stakeholders in the not-for-profit sector, the energy and water ombudsman, and other important bodies. We could not have done what we have done without industry support, and they have very open and willing to take on our feedback, and they should very much be thanked for their input in this process. They have done a great deal of work with the Energy Charter and the body of CEOs of eastern states energy companies who have voluntarily come together to not only provide this process with a secretariat but to appropriately fund it. So I do acknowledge what energy companies have voluntarily done to change a rule which asks people to take steps to further protect themselves and to give us a life support list that we can actually act upon to make more people safe. And as I have said to them, hopefully get us to a point where we have no more avoidable deaths. The way we're going to do that is by asking people to check, plan, and do, to formalize their checklist of what they will do, and also to have a plan of what happens when the power goes out. This plan will include, importantly, medical evidence with your GP or other treating professional showing why you need electrical and medical support and why you are an urgent life support customer. So your GP should be able to help you put that together. And if your piece of equipment that you need isn't listed in this simplified form, there will be a box ticking that you can tick that says other, and you or your doctor will be able to help you put in an explanation. We will also add to this new form a box that says permanent. So if you have a permanent condition that requires life support equipment, you can be registered permanently. And that will reduce the number of times you have to be checked or have to refill in a form, making your life simpler. Of course, what we're asking you to please do is to go online and fill out a plan of what will you do when the power goes out. And please discuss this with your family, friends, carers, and notify any bodies or institutions that you will go to before a power outage so that they know to expect you. So it's well planned, and that when the power goes out, you know exactly what to do, who to call, and they know to expect you, and they can come and assist. Now, I can't tell you that this will work 100% all the time, but what I can say that we will have a far better strike rate and people will be far more comfortable than they would be otherwise. Because at this stage, the life support lists are so long and there is so little information on them that officials have told me that there is no way for them to work out who is the most in need at what time. This reorganization of the plans and the rules will allow the companies to prioritize the people and areas they attend to so that those most in need get attention and hopefully power restored first. I would emphasize, though, we are not attempting to leave anybody behind. Nobody will be left behind. We just ask you to go to our website to follow these three ideas of check, plan, do. Check, you've got a checklist of what you will do when the power goes out. Prepare a plan with your treating professional and then be prepared to do it. Implement it when by necessity we will have power outage.
Thank you for that, Adam. That was really detailed and really gives us food for thought. I now want to ask Carolyn a follow-up question. And it's, for me, I've been thinking about it when I've been hearing both your stories. What kind of supportive communication makes a difference for you in those moments of a power outage?
Good question, Ricki. I think it's really important to do the thinking, the difficult thinking and the complex thinking and discussions with your network before this happens, because as Adam mentioned earlier, he was in a big panic. I certainly would be in a big panic when the power goes out, because you just don't know how long it's going to go out for. You don't know if it's going to go overnight, or, all these things that are going to affect you and your healthcare. It's really important to do the heavy thinking, I guess, the heavy lifting before there's even a problem, and do it on do some scenarios, do all that kind of hard work before it happens. Even have a dry run, like do a practice. But I think including people like your neighbors, is really important, because they're going to be the ones that are going to be able to be there first on the scene in a situation. If there's an emergency, it's really important. Like, I've been able to have lovely neighbors and get to know them, and I've sort of made it part of my job to actually get to know the people in my local community, because they're going to be the ones. Like, it's no good calling your best mate who lives interstate, because they're not going to be able to be there on the day and help you with the power outage. So get to know the people in your local community. I went and spoke to I've got a fire brigade station around the corner from me, so I went to talk to the fire brigade and let them know who I am, where I live, and these are the things that we need to do if there's a situation, an emergency situation, or what have you. And they're the ways that they get to know the people in their local community. So I think, very much having those conversations with your network, whoever your network is, your family, your friends, your carers, people in your local neighborhood, and your direct neighbors are probably one of your best assets. But also having conversations with your medical professionals, as Adam mentioned earlier. So your GP, but also your prescripting people. If you've got like physios or OTs who have prescribed equipment for you, have a really good conversation with them about what happens when the power goes out.
With all the future focus now on what's taken place for the past, few years, people working so tirelessly on creating resources, refreshing the whole area, can you tell me, what advice would you give energy companies right now who are working with people on life support systems and other organizations? How best can you work with our community?
Such an important question. Thanks, Ricki. I think, energy companies and, other government departments and providers, policy, anyone involved in supporting people, or trying to make a better system for people, particularly vulnerable people in our community. I think that they really need to know that working directly and genuinely with people in your communities, so people with real lived experience, life experience, people with disability and a range of other health conditions, people that are performing, grassroots jobs like carers and, support workers, and the people who are at the front line. These are the people that make these resources and these policies come to life, and they make them more accessible and inclusive, because we use language that people understand. We use photographs people relate to. We're able to tell stories that are, real experiences, not made up ones. It's just really important for policymakers and the industry to work collaboratively and genuinely with people with lived experience. And I hope that the work that we've done on the energy panels, the Energy Charters Life Support Panel, has been able to encourage other sectors and other industries to do the same, because it's really a great result when you're working. The process is so good, therefore the results are so good, and they're actually having a lot of good buy-in with our communities. So one thing I wanted to raise, Ricki, if I could, was that we've also got the Check Plan Do website in easy read. for people, who might respond better to more simple and plain language, for people with learning disabilities, and for everyone. It makes it easier to understand what's happening. We've also got websites for the cold community, so different cultures, different languages, and we've also got a First Nations design for the website as well. So we've put a lot of thought into actually making the resources usable for people, because we actually want everyone in Australia to jump on and tell their friend, tell their nana, tell their grandma, help their neighbour, help the family and friends that they know, that to get on and prepare for power outages, because we don't want to see any more tragedies in the world about losing people when the power goes out, and it's too late afterwards. We need to do the work and the thinking and the planning now. So I encourage everyone to spread the word to all of the communities, and use these resources that we've been able to create.
One more of a follow-on question for you, Carolyn, before I ask Adam a real sort of deep dive question, and that is, now I'm putting back my old teacher's hat on. What about for those of us who used to teach in special schools as teachers, as well as other secondary school teachers? Do you think it's important for teachers to, one, really become familiar with the website, and then perhaps provide this as a curriculum resource for kids in the classroom to be ready for power outages?
Wouldn't that be fantastic if we had educators at all different levels, whether it's primary schools, high schools, in, adult education like TAFEs and so forth. If the students can go home and talk to their families as well, because a lot of, older generations might not get these messages if they don't speak English, or, there's English as a second language. A lot of people are perhaps not on social media. Not everyone is clicking on Facebook or on Instagram and getting the latest up-to-date information. So wouldn't it be great if the teachers could give this information to the students, and then the students can go home and do their homework and talk to their families and their neighbours and their friends, and get the word out? That is such a great idea. I think we'll push that idea through the Energy Charter, and try and get a campaign up with teachers. That's a great idea, Ricki, because it's a really important message for everyone in the community.
Adam, I wanted to ask you, you've been with this initiative for quite some time, and it'd be great to get your reflections now about how do we keep doing this type of model of using living experience, expertise as a central part to solutions in this space.
We do it, Ricki, because we know from credible academic and grey literature evidence that it works. And I would cite other organisations in the health space, like Health Consumers New South Wales and the Consumers Health Forum, who know how to do this. Going on from that point, we do it because we know it works. We also know when we're drawing on what we call lived experience, that has a ripple effect, and suddenly we find a great well of need, and people who were previously not informed, and they step forward, and we find whole communities. We learned this through COVID, where we found people who had not been in contact with the service before, but were stuck in their homes for various reasons, and were not able to get out and have COVID injections. So we know there's a lot of unmet need there. We've known in the disability sector since time immemorial that there's a lot of unmet need. So it's essential to go out and try to find people and talk to those who are literally living the experience, to find out whether the services you think you're providing are actually meeting the needs that are there. And what the Energy Charter has done has gone out to various bodies and found a lived experience panel to advise them on how to reach the communities they need to reach, to tell them about the changes in the life support register. And what we've attempted to do there is to bring people on a journey of reform, not to frighten them, but to improve the ultimate service. That's why I'm hopeful that the future is one of a better informed public, a better informed energy uh, providers, and ultimately a position where, as Carolyn says, there are no more avoidable deaths. And I think that the most important and worthwhile thing many of us could achieve. Can I also thank all the members of my committee? They are all people who are very, very outspoken and very capable advocates for their communities in their own rights. My biggest challenge was to corral and unify them around some central ideas, which they were very happy to support me in as well. So I'd just like to thank my committee and again Beck Jolly of the Secretariat for the work we've done together and how they've supported me in my role as chair.
It's been an absolute pleasure having both of you to come on our show and really highlights the important work that's being achieved through the Energy Charter on life support in the home. It was, I think, one of the best experiences of my life being in a space where I feel we have made a little bit of a change in the landscape, and both of you have really highlighted today the importance of every Australian listening to this to really start having a conversation at home, first with your loved ones and neighbours and at schools, going on the website, because life support, I always say, is everyone's business. Every life matters, every life is important, and let's all support each other, work as a community to make outages something that can be managed, and with looking at the Energy Charter, with the resources that you both have led the way and created, I'm sure it will only get more and more developed over the years. And thank you so much for coming on our show, Our Health Matters, Quest by Community. This is Ricki Spencer signing off.